Hey, Elmise, I hope you guys are doing so well. Thank you for joining us on our webinar this day, or today. We are really excited to be joined again by Dr. Dorothy Hitchmoth, and she is from the Ocular Wellness and Nutrition Society. So, if you were part of any of the presentations she shared last year, she shared a really incredible and well-received presentation just about taking really good care of your eyes and your nutrition. And she's going to just talk all about how food and what we eat, what we do, all those different things go hand in hand with preserving vision and just making sure that our eyes, one of the organs in our body, are really healthy. So, with that, I'm going to go ahead and bring Dr. Dorothy into the webinar.
Okay, well, hello everyone. It's my pleasure to be here again. I'm going to really just get right into the presentation so that we have a lot of time at the end for me to answer questions. So let's get started. I assume you can all see my screen. I am in practice. I've been in practice about 29 years. I'll say that. I think that's worth a little bit of something. And we have a very simple mission at my office, my practice, and that is to prevent vision loss. And really, that's what today's presentation is all about. That's often all I lecture about. This is a little bit about me. I'm not going to read through this. Happy to send you my background. I often will dedicate lectures to people. I dedicated my last lecture with this group to my dad, and I'm going to do that again. My dad lost an eye to sebaceous cell carcinoma, in fact, part of his orbit as well. And it was his dominant eye. And, I've watched a lot of patients go through the journey of losing vision in one eye or losing an eye or some function. And it's different when it's someone so close to you. And I feel like I really understand in a different way. And that's why I am happy to be here giving you all of the information that I can possibly give to you. I will say that the information in this presentation is general. I will encourage all of you to please see your eye doctor and your primary care doctor and any other specialists that you need to see for individual advice because individual advice matters. Yes, I am the president of the Ocular Wellness and Nutrition Society, and that's because I really do think we can prevent vision through what we do at home, and that what the doctor tells you is important, but what you do at home is most important. The primary objective of this webinar is that you learn something new. And the secondary objective of this webinar is that you help me really evangelize the importance of regular eye care, how to avoid vision loss, and what we can learn about our eyes, about our health through our eyes. I think you all know that eye doctors see patients of all ages and often throughout their lifetime. And I believe we're really in the business of improving and preserving vision. We also regularly identify, I should say, those at risk for vision loss and other health problems. So I always say, on a good day, we help save vision and we help save life. I truly believe that the eye is the window to your health. And one thing that I think may not be obvious, and perhaps your eye doc doesn't talk about this, perhaps they do. And if they do, that gets me really excited. But what if I could say, what are those things that I want my patients to understand? I want them to understand that the eye is really part of the brain. It's not really separate from the brain. And what you do that's healthy for your eyes is healthy for your brain. And when you have a healthy brain, this has a huge impact on how you live and the quality of life that you maintain. And I'm going to go back and talk about that relationship throughout the lecture. Same thing with the heart. The blood vessels in the back of the eye, and there are several sets of blood vessels in the back of the eye, are really part of your cardiovascular system. They're inseparable. So again, what's good for your eye is also good for your heart. And anything that I tell you today or discuss today or share with you today, good for the eye, good for the brain, good for the heart. And keep that in mind as we walk through some of the information. The leading causes of visual impairment and blindness are preventable. Say that again. The leading causes of visual impairment and blindness are preventable. I think I know this is an important statement for those of you who have lost vision in one eye. How do I prevent vision loss in my other eye? And we're going to concentrate on that today. So regardless of your exact diagnosis, there are other health conditions that truly can cause vision loss. And I have obesity highlighted in red here because obesity has now moved into the number one spot for cause of vision loss, right? Directly and indirectly. Obesity drives diabetes, which is now one of the leading causes of vision loss. So avoiding diabetes, maintaining control of your diabetes are really important things. And the way that you do that is to keep your weight in check, which is always easier said than done. And we're going to talk about that today. But obesity, diabetes, poor diet, lack of exercise, and smoking are associated with the leading causes of visual impairment. So this is prevention 101, keeping your weight in check, avoiding diabetes through health management, and not smoking. So if you smoke, quit. If nothing else, that's the number one driver of vision loss. I'm gonna guess that most people who are listening to this webinar today, this education session, do not smoke. So we're going to concentrate on talking about some of the other prevention strategies. About 12% of the adult population in the about 12% of the population, I should restate that, smokes in the United States. That number was over 50% when I was a child back in the 60s and 70s. So we've come a long way on that, but I still think it's worth saying over and over and over again. I keep also saying I'm going to talk about vaping because vaping is 10 times worse than smoking. That's a lecture for the younger folks. But if there's anyone out there that's young that vapes that has one eye, like make that your number one priority. I think I should at least say that out loud. So the rate of obesity and diabetes and smoking is a lot. The total diabetes diagnosis prevalence is around 40 million. Pre-diabetes is 88 million. The total number of Americans who are obese, not just overweight, but obese, is 42%. And we still have 34 million smokers. The rate of obesity, diabetes, and smoking is a lot, as I said. And there are areas in the country where it's concentrated. So if you look at this map here and you live in that state, you're in one of the states that has the highest rate of obesity, diabetes, and smoking combined. If you're in a yellow state, you have the least. Yeah, it's a lot. It differs based on ethnicity. You know, why that's true, I think, is a whole nother lecture. But I like to make people aware that there's a big difference in the frequency of smoking across cultural and race groups. The rate of blindness, this is no surprise to those of us who are eye docs, is actually going up as the obesity rate is going up and the rate of diabetes and poor diet, quite frankly, is going up. One of the easiest things to understand about diabetes is, are you at risk? If you are overweight, if you're over 45, if you have one parent or one sibling, your risk goes up precipitously. If you are physically active fewer than 3 times per week, if you ever gave birth to a baby that weighed more than 9 pounds, or you had diabetes while you're pregnant, which we also refer to as gestational diabetes. So think about that a little. You know, I have lots of conversations all day long with lots of patients, and a lot of patients are really surprised when their primary care doc says, "Hey, you have pre-diabetes," or even more shocked that they have diabetes. And a lot of them don't even know some of these risk factors. So these risk factors matter. They're strong. You can actually delay diabetes by up to 5 years by losing 5% of your weight. That's a relatively small goal that can make a big difference as an example. So keep that in mind. We're going to talk about that a little bit later in the presentation. I would say to also know your risk for macular degeneration. If you are over the age of 60, if you have a family history of macular degeneration, if you smoke, again, if you're overweight or obese, or you have high blood pressure, your risk for macular degeneration goes up. The family history component is quite strong. Again, mom or dad with macular degeneration increases your risk of macular degeneration by 40%. As many as 15% of Caucasian folks over the age of 75 have this condition. This is common, and it is the leading cause of vision loss over 65. So it's why you'll hear me throughout the presentation talk a lot about macular degeneration, because a lot of us who are Caucasian, Northern European descent are at risk for getting this. I have this risk in my own family. And I also have the risk of diabetes in my own family. I am the oldest of four siblings. Three of my siblings have diabetes, and my mother has diabetes. So I am paying attention. Glaucoma, while not as common, is a eye condition that has no symptoms. And because of that, is another leading cause of blindness in the United States. So a lot of people understand glaucoma is a condition where you develop high eye pressure in your eyes, but the most common type of glaucoma, you have normal pressure. Let me just say that again. The most common type of glaucoma, you have normal pressure in your eyes. Um, and again, no symptoms. So knowing the other risk factors is important. If you are over 60, if you are Black, Asian, or Hispanic, you have a significantly increased risk of glaucoma compared to the Caucasian population. If you have a family history, again, of glaucoma, mom, dad, especially mom, and especially if there's one brother or sister, your risk of getting glaucoma is higher. So ask your family members if you can. If you have diabetes, heart disease, high blood pressure, or sickle cell anemia, your risk for glaucoma is higher. And having corneas that are thin in the center is a biomarker or a marker that you may be at risk for getting glaucoma, and all eye doctors can measure for that biomarker. If you've had previous trauma or inflammation in an eye from conditions like uveitis, you're maybe at a higher risk for developing glaucoma. So those are the three leading causes of vision loss in the United States. And I hope understanding what those risks are will help all of you have a better discussion with your eye doc and also your primary care doc. So diabetic retinopathy, I'm going to talk about this in a little bit more detail. Your risk of losing vision from diabetic retinopathy goes up as you go through the number of years. So the longer you have diabetes, a diagnosis of diabetes, the higher your risk of developing diabetic retinopathy goes. Now, I'll share, my mom has had diabetes since age 38. She is now 85. She has no retinopathy in her eyes because she's controlled her blood sugar for decades pretty well. She's had lots of periods where it's not been controlled, but overall, she's controlled her blood sugar really well, which is why she's 85 and which is why she has no retinopathy in the back of her eyes. So even though you're handed a diagnosis, doesn't mean that you can't do something about it. And I'm banking on that myself. So controlling your blood sugar matters. If you have diabetes, controlling your blood pressure matters a lot. Controlling certain types of cholesterol matters a lot. If you smoke and you have diabetes, that's a quadruple whammy. You will develop heart disease at 10 times the rate. So be aware of that. That combination is deadly, quite frankly. Forget about vision loss. And if you're African American, Hispanic, or Native American, your risk of developing diabetic retinopathy is higher than those who are Caucasian. You can actually take a risk test. I like to give people tools that they can use that are available. So if you're bored listening to me at any point during this presentation and you want to know if you're at risk for prediabetes or diabetes, you can actually go to doihaveprediabetes.org and take their tests. It will ask you a variety of questions. You enter those, and then it will tell you what your risk is. So if anybody does that during the presentation and you get a risk score, and you want to share, or you have questions about that, please pop that in the chat as we get to that part of the presentation where we get to chat with each other and have a back and forth. I call this a really bad food timeout. There are a couple of things that are in the American diet that are so bad that I can't not talk about those things as individual dietary things, if you will. So, fake fat and no fiber is bad. So, fake fat actually kills some of the healthy bugs that live in your stomach, in your gut, and prevent your body from metabolizing or digesting sugar in the way that it should. So, eating fake fat can actually cause you to have diabetes significantly sooner than if you did not consume fake fat. Now, thankfully, the government is involved in getting some of these bad components out of our prepared foods, and that's a good thing so that we're not consuming these things, quite frankly, by accident. And we're going to talk about what's fake fat later in the presentation. Same thing. Fake sweeteners are no good. So if you've been told by your doc to cut carbs or cut sugars and you're adding in fake sugar, so that means saccharin and some of the other artificial sweeteners. NutraSweet is one of the name brands that's common and used ubiquitously practically in all prepared foods. Same thing. It actually kills some of the bacteria in your, or the specific bacteria in your stomach that are responsible for metabolizing sugar. So again, fake sweeteners and fake fats can actually lead to diabetes, especially if they're something that you consume all the time. So what do I mean by that? Diet soda, that's a big one. Chips with fake fat, that's a big one, to be really specific about a couple of common foods that people consume. So, can vision loss be prevented? Yes. If you maintain your blood sugar levels, 90% of blindness caused by diabetes can be avoided. That's an amazing number. Now, maintaining your blood sugar level is the challenge, but it is possible, and we've measured this over and over and over again in the public health space. If you have a BMI of greater than 30, your risk is 2.5 times more that you'll develop macular degeneration than somebody with a lower BMI. So there's that obesity thing again, right? It drives diabetes, it drives macular degeneration. Smoking increases your chance of macular degeneration by 2 to 5-fold, and we talked about that already. These are just public health facts that I'm restating. People with diets that are elevated in fat and cholesterol and high glycemic index foods and low in antioxidants and green leafy vegetables may be more likely to develop all three of the leading causes of vision loss: macular degeneration, diabetes, and glaucoma. So food matters, right? High blood pressure and a lack of exercise are associated with macular degeneration, increased risk. We also know that eye vitamins can slow or prevent the progression of macular degeneration in about 25% of people who take those supplements, according to the very well-known, now famous age-related eye disease studies. And I say studies because there are over 30 reports from this group of studies that the National Eye Institute has funded for my entire career, which is the last 30 years, which is really an amazing and massive public health undertaking. And I'm sure all of you, if you watch TV or look at social media, you will have been bombarded, if you're over 50, with ads for AREDS vitamins or AREDS 2 vitamins. They do make a difference. Food matters more. Boosting your intake of leafy greens is associated with a reduced risk of developing glaucoma, also macular degeneration. And there is a positive association. This is a big one that I think I don't talk about enough between tooth loss and primary open angle glaucoma. And in the last 10 years, we also know that poor oral health, gingivitis or periodontal disease, if you brush your teeth and you see pink in the sink, you're at risk also for getting dementia or Alzheimer's. So taking care of your teeth is critical. It is critical, critical, critical. And I'm sure my friends in dentistry would love to hear me say that. Um, but it is true. And yes, there are things you can do at home to prevent oral disease as well. Oral disease matters a lot. Same thing with diabetic retinopathy, even though I don't have that written on the slide here. And having insulin resistance or diabetes does drive your risk also for glaucoma. So in the end, I think the take home this afternoon that I hope is becomes apparent is it's in your hands. It's not your doctor, it's not medicine, it's not some crazy juicing diet. It's really what you put in your mouth and what you chew that matters and will change the health of your eyes, in your brain, and your body and affect the quality of your life. It is in your hands. And this is something that you have to think about every single day. I think this goes without saying with this particular group, but I put this in here so that you can help me evangelize, so you can help your family members and your friends and your tribe and your church or whatever group that you touch in your life on any periodic basis. For people over 65, and most people over 65 have Medicare or Medicare Advantage as an insurance, only 45% of that population has had an eye exam, which to me is stunning. So just getting your eyes examined for a baseline, to have a discussion with your doc about your risks and to understand your risks is incredibly important. All of you know that eye exams have saved your vision or your life. So what can you do to prevent vision loss in both eyes or one eye? If you've lost your spare, as I call it. Watch for symptoms really closely. There are some that are more important symptoms than others. If you have blurry vision that has come on more suddenly than gradually, that's a reason to go back to your eye doc, even if you don't think it's time. Better safe than sorry. Simple blurry vision can be a warning sign. A change in vision that is abrupt or less than subtle is a reason to go back to your eye doc. Distortion of vision is a big one. So, for example, what do I mean by that? If you are looking at something that you know should be a straight line, like a door jamb or a window sill, and it's not straight and it's like a little bumpy or waving, that's a vision test. It's a really good vision test. If you're looking at anything that you know should have straight lines in there, they do not have straight lines, that's a get to your doc right away. And that means within days, not weeks or months. If you see flashes of light in your vision or new floaters in your vision, that's a get to your eye doctor call today. Eye pain that lasts more than an hour is a get to your doctor right away. Eye redness is check with your doctor and run your symptoms by your doc. And anything else really that's new, anything that you think is a change and you're not sure, just go ahead and get checked. Sometimes peace of mind is worth a lot, and you'd rather be safe than sorry, is what I tell my own children. So, the father of medicine, at least of what Western medicine, the person that we've identified as the father of medicine is Hippocrates. And he said, let food be thy medicine and medicine be thy food. This is still true. I still believe this. And that's what I want to focus on today. How can we let food be our medicine and help us prevent vision loss and live a better life? The Mediterranean diet, Mediterranean diet, Mediterranean diet is super important. And I'm going to stop talking about the Mediterranean diet and start concentrating on what it means and what is the miracle of the Mediterranean lifestyle. Really, that is what I would love for the group to understand if you don't already understand this. The wonder of the Mediterranean lifestyle has been promoted pretty much on every social media platform, television, you name it. So if you haven't heard about the Mediterranean diet, I would be surprised. I think the challenge is understanding what Mediterranean lifestyle really means. And I hope we can dig into that a little bit today. I happen to have the benefit of having an Italian mother, full-blooded Italian mom. So I grew up with a lot of the foods that you see in this picture here. It would seem weird to me to not have these foods in my everyday life. But the Mediterranean lifestyle also means being with family and friends and having purpose. And we'll talk about that a little bit. And the power of food and the types of food that are in the Mediterranean diet. There are other diets out there that are similar to the Mediterranean diet. I'm just going to focus on this one because it's one of the more well known. But you can ask questions about some of the other diets that have been promoted, such as the Okinawan diet, the Nordic diet, very similar to the Mediterranean diet. But we can actually change our genetic destiny through nutrition. The way that your genes are expressed is controlled by your food. So even if you have all those risks that I talked about earlier in the presentation, you can change that risk with food. You have to use your food as medicine, and you have to be consistent and systematic about it. But have fun figuring out what that means. Easier said than done. And let me just say, I'm not the only evangelist, right? I happen to be the president of the Ocular Wellness and Nutrition Society, but the Center for Disease Control, the American Heart Association, the American Cancer Society, the National Heart, Lung, and Blood Institute, and so on. We're all recommending the same types of healthy foods and healthy lifestyle. There's not a lot of difference. I'm bombarded on yes, I'm an old lady. I sort of define myself by admitting what social media I tend to look at. But in my Facebook feed, I'm bombarded every single day with all these fad diets and eat this. And, you get sucked in and people are telling you all these things that you need to eat this one food and you'll live forever, or eat this shake and you'll live forever. I'm going to get cut right to the chase at the end of this presentation and share with you some information that is completely free and that you can start using right away if you don't know about it already. I'm going to talk about a couple other facts before we get into the food discussion, because even if you think you're eating healthy, you may not be eating healthy. And I want to make that point by saying nearly everyone failed to meet recommendations for dark green vegetables, orange vegetables, legumes, that's beans, and whole grains when surveyed in the United States. We're calling this a U.S. diet crisis. So what that means is nearly the entire U.S. population does not have the diet that they should to prevent disease, period, right? So I hope this helps. We already talked about the obesity crisis, the sugar crisis. We're also having what I call the US sugar crisis. Our food is so loaded with sugar that we don't even know exists, right? I think most of us know now soda equals sugar, ice cream, has sugar in it, cakes and crackers have sugar in it, but there's so much sugar embedded and snuck into the packaged food in the grocery store that you may not recognize as sugar and not even realize that you're consuming massive amounts of sugar. We know that that's happening, right? By what people buy, what flies off the shelves in the grocery store. We're eating a massive amount of sugar compared to the sugar we're eating over a century ago. I don't have this in my presentation, but there is a doctor by the name of Dr. Robert Lustig. He's been nicknamed the sugar doctor, and he's written 5 books about sugar and how it has snuck into the food supply. So if you want to read further about the 50 different names that we've come up with that are food ingredients that are really sugar, I would suggest looking him up and looking at his website, and that'll give you a good idea. The other thing you can do is just avoid packaged food. That's the simplest thing to do. There are other exposures that can also reduce what you take in for nutrients. I've listed a few of these here, but I think a lot of people don't it may not be top of mind. I don't want to sound insulting and say, oh, people don't know about this, but our water supply, having copper pipes can actually deplete some of the nutrients that you consume in your body. If you overconsume calcium, if you overconsume uh, fried foods because they're filled with trans fats, if you have hormonal imbalances, there's a whole host of medications that can deplete nutrients. We know that sugar and smoking also deplete nutrients, as does the chronic use of heartburn medication and aspirin. So this is why I emphasize at the beginning of this presentation that you should talk to your doc about your individual situation, because there may be a lot of exposures that you have that reduce your ability to uptake nutrients, even if you have a healthy diet. And that's something for another lecture. I do love this book, How Not to Die by Dr. Greger. He is a staunch vegan. I am not a vegan, but he has some great information about how to get more fruits and vegetables into your diet. And it's just a general recommendation that I have for books. I have lots of other recommendations. There's a lot in the pipeline in terms of what I refer to as ultra prevention, but I'm going to talk about some real simple things today. And as I said earlier, there are a lot of highly rated health apps, but there are over 200,000 health apps now. That's really confusing. Here are some of my favorites, and I'm happy to share this list, but I will tell you my list changes constantly because I can barely keep up, and I'm going to try to cut through all that noise as we talk about food. So, if you're not sure if you're eating healthy foods, there are questionnaires that you can take to understand how close your diet is to the Mediterranean diet. So if you're a real scientific type and you want to get right down to the nitty-gritty and you want to score yourself and understand whether or not you're close to the Mediterranean diet or not, there are a number of questionnaires out there. I was going to have a list of those prepared, but I didn't have time to do that for this particular presentation. But let me review the visual here. Being physically active and eating with others is something that you should try to do if you're not doing that now. What you eat slower when you eat with others, your cortisol, your stress hormones are lower, you digest your food better, and your nutrient intake goes up if you're with people you like. So that means friends and family and people that make you happy is number one, actually, in terms of intaking food that's healthy and digesting it the proper way. I don't think we talk about that much as docs. I don't think you hear about that very much when you listen to the health pundits that are in the world. What you should be doing is making sure that you have certain foods in most of your meals that are olive oil, avocados, greens, healthy whole grains, and that's a confusing point. Nuts and seeds, I have preferences. Some seeds you should not eat. Walnuts, for example, are a much healthier nut. Brazil nuts. Sulfurane-based vegetable or foods like garlic and onion should be a regular staple in all the citrus fruits as well. A couple of times, actually 3 times a week, eating fatty fishes or foods that have omega-3s that are high in omega-3s is important. Eating moderate portions, which you automatically do if you eat a meal with folks, if you can, and eat less more often, so smaller meals. There's some notes in there about drinking more water, yes, or drinking more fluids, healthy fluids. There's a note in there about drinking in moderation. I'm going to say maybe not on that one. There's too much in the research now that says even small amounts of daily alcohol are probably not good. I will tell you, even though I have an Italian mom and a large Italian family, that most of us do not drink. And I do not drink any alcohol at all. I know that sounds really boring probably for some people, but the older you get, it's much more difficult for your brain to recover from the alcohol exposure. And it's a neurotoxin. So that's one thing I'm like, yeah, you should cut that out too. But all the healthy foods that have resveratrol or something called polyphenols. So polyphenols are a really, really, really super, super important nutrient, but it's also in other things that are not red wine, like blueberries and in fact, any kind of berries and all your purple foods, purple fruits and vegetables. And we'll talk about those a little bit. Um, there are some tests out there, little blood spot tests. This is just happens to be one, and I have no financial interest in this company or anything else that I mentioned in the lecture today. But I like Tina. Tina is an at-home omega-3 blood spot test. So this is a super simple test. You can go to their website and order it. You can take the blood test at home. You send this little card in, and it actually tells you if you have healthy or unhealthy levels of omega-3. Omega-3 is a critical fat to have in your diet. It was naturally in all of our diets in the United States in the last century. It has been stripped from our diet. So it's not that it's a miracle food or a miracle cure. It's that our diet is largely absent of this food. So understanding your omega-3 to 6, 9 balance is important. Most people should have more omega-3s and less omega-6 in their diet. So that means more olive oil and fatty fishes and less red meat, not zero red meat, but less other meats and less other foods that have omega-6, right? So with this test with Tina, you can track, you can get a baseline blood spot test at home. You can bring it to your doc. I would encourage you to do that. You can change your diet and then you can retest to see if what you're eating is making a difference in raising your blood levels of omega-3, which helps prevent diabetic retinopathy, it helps support glaucoma, and it helps prevent vision loss from macular degeneration. Again, those three leading causes of blindness. The goal of that particular test is improve and monitor the impact of dietary habits on retinal omega-3 and get to the right level based on Mediterranean diet recommendations. Okay, so that's just one. There's they're adding some testing capability that will come out soon to see do you have enough lutein, zeaxanthin, vitamins A, D, E, and coenzyme Q10 and curcumin levels in your blood. So those are the nutrients that are important for preventing vision loss. Those are some of the primary nutrients important for preventing vision loss. They're not the only ones, but if you're super high risk or you already have an identified eye disease, these become a little bit more important. And you will be able to test your own blood at home to see if you have enough of this in your bloodstream to make a difference on your eyeballs. So that's kind of cool, super inexpensive, and will be broadly available. And even your primary care doc's not going to test for these nutrients, but I think many of them would be interested. What's hanging around in your blood based on what you eat, and that's the purpose of these tests. So I'll leave some QR codes in case you really want to take a look at that. So what do I tell my patients? Right, I'm going to get the whole gamut here. It's hard for me to get all this in, but I repeat, 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 and then I do webinars like this that are recorded so that my patients not just the audience here, but so that my patients can hear me talking about for over an hour what I really think and maybe have some take home education. So follow a heart healthy diet. That means a Mediterranean lifestyle. Eat foods, plant-based whole foods. That means you can identify what the food is. Eat lots of fruits and veggies and healthy proteins and healthy fats. And I'm going to talk about that in a moment. Move around 150 minutes a week. And that doesn't mean you have to go sweating in the gym and running and walking. It means move, get off your chair, get off your chair, get off your chair, move around, move around, move around naturally is actually preferred, especially if you're over 65. Reduce stress, meditate. That's a hard one, right? I mean, some of us naturally have stress. How we handle stress is individual, but there is one thing that at least the research tells us that if you learn how to meditate, even for 1 minute, you can reduce your stress and your cortisol level. So that's a bad hormone that drives disease. It makes everything that I mentioned worse in terms of eye disease or body disease. Even 1 minute. So you don't have to become a yogi. You don't have to learn how, go to all kinds of meditation classes to understand how to meditate. There are super simple apps that are what I call time out meditate apps that you can download to your phone. And you can just read, how do I do a 1 minute meditation is better than zero meditation. If you do 3 minutes a day, massive impact on your health, right? Sleeping is key. The rate of insomnia in the United States is off the hook. Why is that? Poor diet, by and large. There are other reasons that people have poor sleep. And again, that's why these are general recommendations, and you have to talk to your doc about individual circumstances like sleep apnea and a whole bunch of other things that can interrupt sleep, to include lots of mental health diagnoses. But eating and getting the proper balance of fruits and vegetables and omega-3s in your diet actually can help you sleep. It can reduce the rate of depression. It can help you meditate better. So again, these are the recommendations, but how you get there is the food. And so it has broad application. Maintaining your weight, again, healthy food will help you automatically maintain your BMI. And for this group, don't forget to wear your safety glasses if you don't wear glasses all the time. And I'm positive that all of you have heard that from your individual eye docs at a minimum if you've lost vision in one eye or lost the eye itself or one of your eyes. Blue light blocking glasses, probably important. There's some controversy on that. I have screen blockers on all my computers and also on my phone, and I put the blue light blocking settings on all my electronic devices. If your diet stinks, you're probably going to need to supplement above and beyond. Never smoke, and I joke with my patients, read that Ocular Nutrition Society brochure in my waiting room. There are some books that have been published in the last few years. These are a couple of books that can help that list both recipes and foods that you should concentrate on for eye health. And here's sort of bottom line information. These are the most nutrient dense foods. So every single one of these foods are good for the eye, the brain, and the heart, the body, essentially. And I'm going to leave this here and pause. And if this is what your diet looks like, you can shut off the presentation right now. um, I will give you some examples. I eat probably 10 eggs a week. I happen to hard boil my eggs. I drench them with olive oil. I sprinkle herbs from my garden or from the farmer's market on my eggs every morning. So those dark green herbs actually help you absorb, and the olive oil actually helps you absorb the good stuff that's in the egg yolks. I eat every morning also some form of a berry. At lunch, I rip off a piece of dark chocolate. That's the most favorite part of my day. Has to be high quality dark chocolate, higher than 75% cacao. I eat several avocados per week, green leafy vegetables almost every single day, more than once a day. And I eat tons and tons and tons of sardines and salmon and peppers. And I buy pumpkin in the can, even when it's not available in the fall. And same thing with sweet potatoes. I buy it in when it's fresh, I buy it fresh. When it's not available fresh, I buy it in the can. So in the can is actually good. And any of these fruits, vegetables, or foods are generally also good frozen, not avocados. I think most of you know that. And don't forget to drink your water. So again, these are the most nutrient dense foods. And really just pause and take a look at this image and say, do I eat these? I also eat walnuts almost every single day. There's even a study, and I don't have this in the presentation, that says if you eat 3 tablespoons worth of walnuts a week, that you live longer, never mind have better vision. This is a little bit more like the Mediterranean diet. Again, eating with people, slowly preparing your food, slowly eating your food, and being mindful about how you just walk through life with the people that are around you and that you love. Having purpose is something that you can think about and do, right? In my family, there are two terms that we use all the time. And one is mangiare, and that means eat with purpose, and also alla familia, with your family. And those are important things. And and defining family is something that you do. So food, joy span, health span, tribe, family, these are all buzzwords in the health world, if you will, right now. And health span, I'm going to talk about this for 2 seconds, are the healthy years or the number of years of disease free in your life. And so there's a shift now in medical research and even in the development of nutrients and supplement. What are the things that really give you healthy quality years, not just longer years? And another term, the joy span. This concept goes beyond the span or how long you live. And it highlights that a long life is not necessarily a fulfilling life if it lacks joy, connection, meaning, and purpose. So those things matter for sure. And I want to just take a little time out here, especially for this group, and talk about fall prevention. Say, wait a minute, what are you talking about falls for? I thought we were talking about food and diet and how important that is. There are a lot of you who are listening who have lost your depth perception and may have some poor contrast vision, either because of that directly or indirectly. And as you get older, your risk of falling and not seeing where you're stepping actually goes up. And that's associated, believe it or not, with a significant increase in mortality. But there are things that you can do to prevent falls. And one is keeping your brain healthy and your mind sharp. So everything that I just talked about just now is also going to help you lower your risk of having a fall. Now, of course, paying attention and learning new ways of navigating through the world, which is, I think, again, a whole nother discussion or lecture or webinar, if you will, is important. But I just think it's important for me to always mention that what you eat can actually help prevent falls in an indirect way. And I would ask all of you that are with us today to multiply the power of anything that you've learned here that you think is helpful. Talk to parents and grandparents and kids and grandchildren and tell them what you've learned and try to share that pathway to help. That in and of itself, I hope will give you some motivation and purpose. An ounce of prevention is worth a pound of cure. And it's never too early to think about changing the way that you eat. And this is something that I share with everyone, and it's something that I truly try to live by as a doctor and a provider. This is a term written in the oldest Chinese medical text. Superior doctors prevent the disease, mediocre doctors treat the disease before evident, and inferior doctors treat the full-blown disease. I don't want to be that one. Here are some additional resources. I would love to have a generative discussion and answer any questions that people have, see what everyone has to say. So thank you for listening.
Yeah, of course. Thank you, Dorothy. This was fantastic. Those of you guys listening, thank you for being here. And I just want to make a minute or take a minute and thank our sponsors again for making this possible. Our webinars are one of the best ways that we are able to educate our patients. We do record these, so if you missed any parts or you just want to go back and listen, we do have this available on the recording. And we hope that you'll share it with friends on our YouTube channel. I have a couple of questions, and then those of you guys in the chat, we have I'm going to say about 8 minutes for questions. And if we have any questions that we're not able to answer right away, then we'll do our best to get those to Dr. Dorothy later. So my first question is that if I have lost my eye or my vision in one eye, but I've never needed glasses before, is it still better and safer for me to wear glasses? I think that's kind of one of those questions. Like, I don't want to wear glasses. Like, I don't need them. So do I need to wear them to be safer? And, what about glasses would protect my one good eye?
Yeah, so that's a great question. The answer is yes. There are so many studies that show that people who are wearing glasses are much more likely to not lose the other eye, even if they don't need glasses to see. So you want to make sure that any glasses you buy have safety plastic in them called polycarbonate, and that the frame and the lenses are properly made. You know, there's so much stuff available online now that's kind of crap, if you will. So I would say go to an optical that you can walk into and share with the opticians, the people that make glasses and fit you for glasses, what your situation is. Or of course, talk to your eye doc. You should be seeing your eye doc. Say, hey, what's the best frame lens for me, for my situation? They're pretty much all going to give you the same advice, but the answer is yes, yes, and yes. But you don't want something that is going to fall apart, shatter into your eye, and make things worse. But most lenses are made out of plastic. They're very, very strong plastic and absolutely will protect the eyes. So, and they're a fashion statement now. So,
I mean, if you need one, why not get like five?
yeah. Well, that's
Especially if you
me.
can get, yeah, if you can
Yeah.
get some decent ones that are, polycarbonate, of course. I think that
Mhm.
was something that as a kid, when I got glasses, I was always like, well, why do I need those? They're called glasses. Aren't they made of glass? And yeah,
Right.
shattering in your eye totally makes sense. We definitely wouldn't want that.
And polycarbonate plastic is what they put on airplane windows. So like
Oh,
it's that strong.
Okay, you talked about supplementing for if you're just not able to get an adequate amount of some of these, recommended foods in your diet. I know you mentioned one of the kind of top areas that a lot of people tend to be nutritionally deficient in is the omegas. So, do you have any specific supplement brands that you would recommend people look into? I know that there's a lot out there in the supplement world, and it can be really confusing. And so, anything that they should look into there, or maybe what to look for on the ingredient label, even?
Mhm. Yeah, so that's a great question. And my advice has changed on this over the last probably 10 years or so. To be really clear, eating foods rich in omega-3 is much, much better, and your body will absorb that fat much better if you eat the foods. Supplementing is a last resort. And one thing that we've discovered in the studies over the last few years in particular is a lot of the pill form of omega-3, the fat becomes rancid. And so that's why in a lot of cardiac studies and eye studies, we couldn't show after supplementing people with the pills that there was an impact to their vision or their health. But when you look at people that eat those foods, it was quite dramatic. So there are some brands out there that are probably better than others. My number one recommendation, if you really don't want to eat fish, for example, is Carlson's cod liver oil, and it comes in a green bottle, and you put it in the fridge, and the likelihood of that particular supplement going bad is a lot lower. But if you can, eat the foods, eat the foods. If you do not like fish, or if you're a vegan or vegetarian, chia seeds are one of my favorite omega-3 foods, and you can actually soak those overnight and add it to other food like yogurt or something else that you may eat. Same thing with walnuts. Even if you don't like walnuts, you can crush those up into a powder and actually add it to other food, and you will get similar benefits. So you can make your own supplement at home really, really cheap. Vitamins can be overpriced, confusing to understand. The total milligrams that you're going to look for on the bottle of DHA EPA should really be in the 1200 to 800 ratio. DPA EHA, those are the components of omega-3 fat foods that you actually should be exposed to at least every day. So if you eat, I know not everybody eats sardines. I happen to really like them. It was like this treat food when I was a kid. I know that's weird. I eat 52 cans a year, like every Saturday, that's my food. Find your food, find something like that if you can. But if not, talk to your doc, talk to your nutritionist, talk to a trusted resource that is nationally known. Nordic Naturals is a brand that a lot of eye docs love and recommend. PRN is another brand that eye docs love and recommend, and they have good quality supplements. But the old-fashioned cod liver oil, and those of you who are a little bit maybe older than me may remember your mom giving you that because there's vitamin D and vitamin A and vitamin E in that oil as well. Hope that helps.
Yeah, of course. So you talked a lot about diabetic retinopathy. We in the ocular melanoma community, if we have plaque brachytherapy or anything radiation wise to the eye, we end up with something called radiation retinopathy. Do you have any kind of knowledge of kind of studies out there that are maybe emerging to show if doing things, with your food, with your diet, can help in preventing maybe the speed of radiation retinopathy? Because fighting against radiation is a little bit trickier.
It is, but everything that I talked about in the lecture today will help support and reduce or mitigate the effects of radiation retinopathy. So it's exactly the same advice. Is there anything additional or special? Not really. Having that really good omega-3 base, is super, super important, as are all the other nutrients. So Mediterranean diet for prevention of radiation retinopathy for sure.
Okay, I love that. And I think it's so important to note that because I know a handful of patients actually I know a patient who she's in another country, but she primarily focused on her diet after her initial diagnosis almost, I want to say it was like 20 or so, or like close to 20 years ago. And she had a period of time and I'm sharing this as a story with, the intent of sharing some hope here that if you've maybe lost some level of vision and you haven't lost all of it because I think if you go completely blind, I don't know that there's any coming back from that. But she had lost maybe, she had blurry vision, double vision, some of those kinds of things. And she focused really heavily on improving her diet over, the course of a decade. And she actually was able to gradually improve her vision in her radiated eye, despite having a pretty hefty dose of radiation, I think twice to her eye. She didn't just have it once, she had it twice. And she had multiple different scans and things that she shared showing that her tumor had improved and also the health of her eye had improved despite the radiation. So I think I was talking to my kid last night after his swim meet, and one of the big things that we talked about is like mind matters. Like your mentality and what you believe is possible makes a huge difference. So if you as a person believe that your only possibility here is that you're going to eventually go blind from radiation damage, that will probably happen because the body follows what the brain believes. But if you have, hope and intent and you have, the empowered knowledge that Dr. Dorothy just gave us and how to eat and you just gradually make those changes, then there's a huge amount of hope that you could preserve vision or, maybe even improve what you have.
Yeah, I couldn't agree with that more. True hope and a feeling of being with people lowers your cortisol levels and it reduces disease. And that's an oversimplification, but there's so many physiological things that we can measure that corroborate exactly what you just said.
Well, you guys here who are on this call and who have been chatting away a little bit in the chat, I think virtual connection and hope counts as well. So I think, let's just be glad that we gave ourselves a little extra dose of hope today. I think I had one other question. Like this is obviously, diet changes. I think for a lot of us can be one of the most overwhelming things to change. Like diet and physical activity. There's so much, like you said, there's so many fad diets out there. There's so many people telling you what you should and shouldn't do. It can be really overwhelming. And if you are someone who wants, if I'm someone who wants to make these changes, or maybe I just have kind of fallen out of some good habits and back into some poor ones, what would your advice be to someone who's feeling that overwhelm?
Make one change, just one change. Find one food that you like and incorporate into your diet. It would be great if it was one of the foods that I mentioned here. Look up recipes on how to use that food and just one thing. It could be blueberries. It could
Yeah,
be walnuts. It could be dark chocolate. It could be dark chocolate and walnuts. But just
I
one
accept.
food, one food, just one food, 1 minute of meditation, and a couple of minutes of getting off your chair and disengaging from social media. Those are just a couple, in just a little bit, just for 1 week, 7 days, commit to one thing different. And that they say becomes a habit. So,
Yeah. Well, and I can speak to this. I made a lot of changes back in 2022 and it was initially really overwhelming, but that's what I did. I focused on one thing and I told I because I'm one of those all or nothing people. And I don't know if any of you guys out there are like me, but I am one of those all or nothing people. I want to do it all. I want to do it all right. I have, high expectations of myself, but that can be really debilitating, especially if you're going through a stressful thing like a cancer diagnosis or you're recovering from your procedure, things like that. And so I really had to work on the mindset of just choosing to believe that it didn't matter which one thing I chose to do, but that it would be beneficial in the long run. And I think that, that what Dr. Dorothy said, just picking that one thing will feel far less overwhelming. It'll feel far more doable, and it will make the world of a difference in building your confidence in making those new habits.
yeah, and employ help. If you have people around you and you have a good support system, tell them what you're trying to do and say, "Hey, can you bring me something with this? Or have you heard of this food? Do you know how to make this?" People want to help you when you share that you have a cancer diagnosis, whether it be your family or your friends. And I know some people have to walk through this alone, and I actually see that in the community that I'm in. And I think that that makes it hard, but reach out to communities like this. That's number one, if you don't have family and friends, because there are people who care, even if you don't know them, and that understand because of a shared experience. But definitely tell people that you need to eat more healthy foods. Tell them what those are and see if they'll help you. Help is good.
I love it. Well, Dr. Dorothy, thank you so much for your time today. And thank you, those of you who participated in our webinar and who gave us some feedback, ideas, questions. We are so grateful for your participation. And like I said before, please make sure to share this recording when you see it pop up on our social media channels, and share it again with any of your family, your friends. This is something, of course, that's going to be helpful to those of us with ocular melanoma. But like Dr. Dorothy said, this is beneficial to everyone in our lives. So, teaching our kids, teaching our or your grandkids, if you have grandkids, just sharing this information is going to make the world of a difference in making sure that we can have awareness around what can we do to keep our vision healthy.
Mhm.
But thank you again for being here. Thank you again to our sponsors, and we will see you guys next time.
Yep. Thank you. Yes. Bye bye.